September is Sickle Cell Awareness Month. And it's probably hard for you to believe, but more than 20 million people live with it across this world. And African Americans sometimes face bigger challenges due to disparities in the healthcare system. So in this Closing the Gap segment, I talk with UMMC health officials about a new program to help people live through it, as well as survivors and even some organizations that are on a mission to raise awareness and save lives.
A lot of people don't know my story. And a lot of people, when they see me, they're like, oh, you don't look sick.
Danielle Lewis is filled with emotion and tears as she talks about living with sickle cell. The 20-year-old has been struggling with it her entire life, and she admits it has been a nightmare.
I remember telling the other kids, hey, I have sickle cell disease, and I remember them backing away from me and was like, get away from me. I don't want it. And I had to tell them, like, it's not contagious.
People with sickle cell disease start to have signs of that disease during the first year of their life, usually around 5 months of age. Sickle cell disease is the most common inherited blood disorder in the U.S. It causes sickle-shaped red blood cells that can stick together, blocking blood flow and oxygen from reaching all parts of the body. And people with it can experience infection, organ failure, anemia, and heart problems, just to name a few.
Even the people with sickle cell don't know how bad it can be.
As for Lewis, she says when the sickle cells in her body began blocking blood flow to the vessels that provide blood to her bones, the unthinkable happened.
Well, I ended up getting both of my hips replaced, and I have screws in my hands from avascular necrosis, and those are all the metal parts in my body right now.
According to the CDC, it's estimated that sickle cell disease affects approximately 100,000 Americans. And the disease occurs among about 1 out of every 365 African American births. And it also occurs among 1 out of every 16,300 Hispanic American births. And about 1 in 13 African American babies is born with the sickle cell trait.
This is one of those diseases, unfortunately, until it's in your house, you don't really care too much for it. You don't really want to know too much about it until you are affected by it.
Now, the Mississippi Sickle Cell Foundation says the numbers are also staggering right here in the state.
From the north of Mississippi to the south of Mississippi, from the east to the west of Mississippi.
Natasha Roberts is part of the organization, and she says the goal is to educate and increase awareness about sickle cell and also push for more research to hopefully find a cure.
A cure is very important, and I encourage individuals until we get that cure, donate blood. Blood is a big factor. With individuals that have sickle cell disease. Some individuals have to get blood maybe every 2 weeks, 3 weeks, or every 4 weeks.
Dr. Veronica Carrillo agrees. She is the Director of Pediatric Pain Management at the University of Mississippi Medical Center, and she provides much-needed care for children with sickle cell.
I would define sickle cell as it's a silent disease that so many people like you and me walk around with, and they suffer silently.
Chronic pain is a very common symptom that many living with sickle cell have to manage, and it's far from easy. Some have even become addicted to opioids because they're trying to fight that pain.
As I became going to the hospital more and more frequently, I started needing medicine more and more frequently. I got addicted.
Sickle cell disease is almost a synonym to opioids, and we have to reverse that in physicians' minds.
And that's where the Children's Sickle Cell Pain Management Program at UMMC's Center for Integrated Health comes in.
It's a sickle cell pain management program, and it's hard for us to grow our program if we don't have the support, the resources, the funding to do it. That is our biggest challenge.
And this UMMC pilot program takes a holistic approach to wellness rather than just depending on opioids for healing.
We offer comprehensive medical and pain evaluations to kids, adolescents, and young adults that deal with chronic pain and sickle cell disease. And we try to reverse some of the stigma and maladaptive behaviors that we as physicians create when we prescribe opioids that no longer work. And we try to offer them other alternatives. And so physical therapy, something called cognitive behavioral therapy, which is thinking about your thoughts, your feelings, and how you can change your thoughts around those perceptions to have a more positive experience of pain.
The program started back in 2021, and dozens have been helped since that time, including Lewis.
But our success stories all look the same, basically. They're kids that come in with either frequent pain, frequent admissions, most of the time on lots of opioids, and that have lost hope, that say, why me? And that many times don't want to wake up in the morning because they have no hope. And then they hear other people's stories that we tell them. We offer them education around sickle cell and pain and their mental health and how all of those things are interrelated. And we give them tools that help them heal themselves.
Speaking of success stories, Danielle Lewis is now sickle cell free. She was able to get a bone marrow transplant. Her mom was a match and her donor.
And I'm grateful. I'm grateful to have my life.
And so sometimes we can't take away their sickle cell disease like we did with Danielle through a bone marrow transplant, but we can offer them hope. We can offer them other alternatives that they have control over and that they can move forward with in their lives with hope.